Hello and welcome to another edition of Medical Today with me, Jared Ratnam. To be exacting, this is episode 7, season 3.0 of Medical Today. We've got some very interesting things happening on the show. We're going to show you a first aid video, a little something we're doing in season 3.0. We also have a fantastic interview done at a KPJ facility talking about non-cancerous ENT disorders. A lot of information coming your way. But to kick off Medical Today this week, we're going to be talking about the future of healthcare in Malaysia. Now, to do that, I'm joined by Tuan Haji Aminudin Dawam, the Executive Director of KPJ Healthcare Berhad, who's taken time off his busy schedule to join us. Tuan Haji, thank you very much for joining us on the show. It's great to have you here. A lot of things happening in Malaysia at this point, but I guess we're talking about seasons now. We've got dengue, we've got durian, monsoon, and the haze. Yeah. Now, with regards to the haze, there's a lot of advice being given out. What's the standard go-to advice at this point?
3 things. Avoid outdoors, wear masks. Number 3, drink a lot of waters.
Right.
I think the government move, to close some of the schools. I think it's a good idea, to avoid more children, getting respiratory problem due to haze.
It's so interesting that how a country starts to become aware of certain things. Like we have the API now, so everyone is quite in tune as to what the air pollution index or air pollutant index is, and we're learning as we go along. So I guess we're going to be learning more from you with regards to the healthcare scene in Malaysia. So as of 2019 and at where we are at this point of the year, what is the healthcare industry like in Malaysia?
It has been a very challenging and exciting healthcare scene in Malaysia.
I think to be exact, what's the outlook on 2019? It's been exciting?
Recent news because of competition. I think recently, I think you heard there's some international player buy over hospitals in Malaysia.
Yes, that was big news. Yes.
So, so competition will be intensified, with more financial able international players coming to pictures. And we're talking about competition, inquiring customers, competition in terms of being the partnership of the for corporate client and insurance, competition in terms of recruitment of best consultants, which is a shortage in Malaysia, and then competition in getting the trained personnel as well, and so on and so forth.
So, would you safely say that the industry is like football in the UK, where you're all poaching for the best consultants in the country? And now with a shortage, what is the go-to plan or the plan B with regards to that?
A few things. In KPJ, what we have done so far, we have our college, KPJ University College, which trains specialists as well. So we are the first private institution to be accredited to train specialists in 5 major areas: in pediatrician, in radiologists, in orthopedic, general surgery, and physician as well.
Right. So having your own system within your organization, when you talk about consultants and specialists, how many, maybe a ballpark figure of how many consultants KPJ can churn out in a year or in 5 years?
Out of five disciplines is mentioned is now, we can churn out probably 2 for each discipline per year.
2 for each discipline per year.
We have 700 consultants in the group who can train them actually.
But what's the long-term goal on something like this?
We will continue training our own consultants. We're thinking to give some scholarship to them.
Right.
So at the end of their career, of their study, they can work with us.
Now, the Minister of Health has come out to talk about he's very passionate about the primary healthcare industry in the country, and he wants to see the first line of defense solidified in the country. Now, taking that into consideration, what in your opinion should be implemented as the main objectives with regards to primary healthcare for public and the private sector?
Number one, I think we should ensure that private healthcare must be sustainable. So the government should invest in improving access to preventive and long-term care rather than curative.
Saying sustainable, give us one example as to what we can do in the short term to make it sustainable.
A few things. We have to put more budget, more budget to the system. Right. So, example, in my data here, we have at the moment there's about 7,000 private facilities involving in this primary healthcare, and only 2,900 public healthcare services in the country. Of these 7,000 private sectors, they are more clustered in the urban and suburban, and then the rural areas by the government. We need to do something about it, and these 7,000 catered for,
fan it out a little bit more.
The 7,000 catered for only 40% of the outpatient care, and then the 2,900 private public clinic, catered for 60% of outpatient care.
It's quite a strain because it's for the focal point is urban and suburban areas. So we need to think of a way of bringing this out, of blanketing this a little bit more. So that's one of the ideas that are in the pipeline. It's already been established or ascertained, but I guess now it's just as to how we're going to get this done. Now, what are the other objectives that you think is important at this juncture?
For the future, I think near future, Malaysia is getting into an aging population. So the healthcare provider need to train themselves to manage a new niche, senior living care. How can the private primary health services to cater for this population? More promotive and preventive healthcare should also be done. Example, vaccination. So there's a problem in Malaysia in terms of vaccination. There's a certain group of people, we call it hesitate to do vaccination, and this contra whatever effort. So I think primary healthcare should done more to promote this kind of activities.
Create more of an awareness as to how important vaccines are and vaccinations, what it means to a country. Now, moving along very swiftly, I'd like to talk about us as a global player, or rather as a booming industry. The medical industry and medical tourism is starting to boom here. If it's not already started, I think we already are becoming one of the players within the region. Now, where do we stand in terms of being in Southeast Asia, our neighboring countries, and the world, being healthcare providers? Are we at a decent level at this point?
I think we are at par, if not better than our our neighboring countries.
You know how they used to say, like, oh, you want a heart surgery, go to Singapore or what? Now that's no more the case. You hardly hear that these days.
So we have competitive advantages. Number one, we are the world-class facilities and services, both in public and private sector. Continue investing in up-to-date and sophisticated equipment as well. Second, we have excellent quality and patient safety. 13 of our hospitals are JCI accredited, which is Joint Commission, as you know. 4 of it are KBJ, and then 182 hospitals in Malaysia are MSQH accredited. 13 are from KBJ. Ease of communication. Most our specialists are UK or US or Australian trained. They can speak English, and qualified medical specialists. And then the last one is our price. Very competitive. According to one magazine, Patient Beyond Borders, medical travelers could save up to 80% if they seek treatment in Malaysia. Comparatively, compared to Singapore, we are 1/3 of the price in Singapore, and probably half of Thailand.
Now, taking a look at what information you're giving us, I think what's also important is that within Southeast Asia and Asia, there's an upsurge with regards to NCDs, the rise of diabetes mellitus. We've got kids with hypertension problems. It's because of the lifestyle choices we make as Asians or even as Malaysians. Now, what are your thoughts on this? What can we do to be able to help in preventing NCDs especially in Malaysia?
Emphasis on the continuous public engagement programs, both by the public and the private. We should start talking to the public. They'll give the awareness, and do also health screening to the public. Importantly, engage with the Ministry of Education, because we start from the young. If everybody can start awareness to the schools, to the secondary or primary schools, people are aware, and then when they grow up, they're aware of it.
Now, with regards to NCDs, I think the other prevalent thing here is also smoking. Smoking has become a big problem around the world, and we've done our part in order to ensure that we start on that journey to work on a ban with regards to smoking. And I personally would like to see that happen in years to come. Now, with what we're doing, the steps that we're taking, what are your thoughts with regards to where Malaysia is at this point? The measures that we've taken: can't smoke in restaurants, you shouldn't smoke in certain areas. We've already taken a few measures. What are your thoughts on these measures also?
First, we look forward for the Health Ministry to table a new bill on the usage of tobacco, vape, e-cigarettes and shisha in Parliament next year. We look forward for it. So back to your question is now, long term, it's good for the public because it reduces the cost of curative, so we can spend more money in education. That number one. Number two, banning of smoking. We protect children and non-smokers as well, and easier create an environment for the smokers to stop smoking as well, because nobody's smoking around them. If they need to smoke, they have to go outside the building. And then for the environmental as well, the smoking butt create give harm to the environment as well. So the butt, they say can take about 10 years to degrade in the ocean. And then the butt also can pollute between 500 to 1,000 liters of waters actually.
Now, also with regards to vape, there's been a lot of, bouncing from one foot to the other as to the information we derive with regards to vape, and if it's good, if it's not good. No, if you're going to give up smoking, why don't you start vaping? That's some of the advice that's coming. Also, a lot of healthcare people are also talking about it. They say, is this good advice? Is this bad advice? What is your advice, and what are your thoughts on, especially vaping?
I think the recent news in the US, 7 have died from vaping, and more people are severely they are severely affected by vaping. I think we should put a stop of it. It's very dangerous because it goes straight to your lung.
Right.
The liquid.
So vape, in one word, should be stopped. Yeah. Now, I guess then, if you take a look at healthcare in Malaysia, there's one segment that's now starting to become a point of conversation. But it's projected that by 2020, there's going to be 3.3 million aging, or an aging population of 3.3 million in Malaysia. Now, with this information on hand or in hand, what do you think the healthcare industry should start thinking about, and what are KPJ's plans with regards to equipping your facility or your organization in being able to serve this in this space or this demographic?
To put into simplistic answer, I categorize into 4 main area concern. Number one is carer. It can be those medical trained, or it can be the specialist, which is geriatrician, gerontologist. At the moment, we have only 33 geriatrician.
Or geriatricians
in country to cater for 3.3. So meaning one geriatrician to cover 100,000 of population, older population. It's not enough. We need to do something about it. Regarding carer, we should train more carers to train the elderly at home or at the facilities.
Right. Yeah. I don't want to take you off guard, but how many trained carers do you have in your facility at this point?
Now we have 4 senior living care facilities in KPJ hospitals, which is one in Tawakal, in Kuala Lumpur, one in Sibu, Sarawak, one in Damai Wellness Center in Kota Kinabalu, and then the one in Damai Wellness Center in Kuantan. So we have 4. All our carers are trained, and according to the regulation.
Right. Yeah. So we are. KPJ is on its way in.
Yes,
expanding on these services. So what are the other areas when you talk about wellness for those who are retiring or the aged? What other facilities should we be thinking about as a nation? They're thinking about areas where they can live in, like little kampongs for them, so on and so forth, with all the facilities.
Yeah, it's total ecosystem. One is carer, number 2 facilities you mentioned just now. From the national standpoint, I think healthcare service should be provided more effectively and at lower cost to the community if they are clustered together. We call it the so-called special community home or village, for the elderly. Be it for independent living, be it for semi-independent or dependent living.
So if they are clustered, if we bring them together, we can reduce the cost. When you say reduce the cost, can it be done significantly?
I believe so. I believe so.
Right. Now that is one of the sectors that we're looking at very seriously, and also, while we're looking at it, we're also trying to figure out how we can better serve these people. I think the other one we were talking about earlier is also medical tourism, and the subsector of healthcare, which is medical tourism, which has become one of the big objectives for private healthcare in the country now,
and the government as well.
And the government as well. So, with how is the government and the private sector working in order to work in sync with regards to serving people in medical tourism? Because they are definitely going to be the promoters when they go back to their countries.
Yeah. So as a country, Malaysia has the ingredient to propel further in this medical tourism in terms of world-class facilities I mentioned just now, in high-quality services, highly trained medical consultants and nurses and paramedicals. The country also has excellent infrastructure, the airport, the roads, that kind of thing, and then connectivity. I met one American just a few months ago. I asked them why they having an office here. They said, from Malaysia, they can connect it to 60% of the world population from Malaysia in 5 hours travel. It's really amazing. So we have the ingredients. How to propel further? I hope the government to relax on allowing additional hospital space for medical tourism. That's number 1. Number 2, to relax on advertisement regulation. So because of especially in the electronic media.
So you want to see some relaxation with regards to advertising, yeah?
Yeah. And then number 3, government to come up with clearer regulation on telemedicine and use of use of consultation and monitoring, including storage of data as well. And as a country, to propel further, we should move into R&D. R&D in terms of medicine, R&D in medical equipment, IT development, and etc. etc. And last but not least, Malaysia should become a center for medical education in the longer term.
Now, Tuan Haji, I guess the bigger question for you as the Executive Director of KPJ Healthcare is the fact that you need a strong team in being able to help you grow. Now, the team needs to be able to build values and clearly define these values. Now, with regards to your management team, how do you envision this, and how do you bring this or bring your vision forward to them just so they can carry it through?
It's all start with the hiring process. So we do take excellent staff or student, but we also take average candidate that has potential to grow. So when they are, we believe that every individual can be trained and molded into our culture from the beginning. So when they are in, then we give them all the structured talent development programs. So we spend a lot of money in it. We spent last year 11.3 million just to train staff, and then it's mandatory for each staff to have 30 hours training in our group. That's number one. Number two is all the qualified employees to further studies, to take the masters and that kind of thing. And the third one, for C-suite training, we send them for Johor Corporation Leadership Program and to further studies in advanced course in either master or PhD as well. And then we have a workshop, to share knowledge between the consultants, the nurses, and all the executive within the groups as well.
So sharing knowledge, like brown bagging, sitting down and sharing ideas together and sharing whatever they've learned.
Yes.
Yeah, I guess that's very important. But for you, on a personal note, Tuan Haji, how do you find balance? You've got 10,000 employees under your wing, or under your purview now. How do you find that time between work and play? Find that balance in your life?
In short, for my personal life, I'm fortunate to have an excellent team to help me in the office. So I don't bring work at home.
Right.
So work, live at the office. Spend more time with families because that's the most important support group in your life. Have friends. Exercise and watch your body as well. Have a hobby, enjoy what you do.
Right. So I guess the thing here is to make sure you employ the right people in being able to carry out your work. Yeah.
Then you can sleep well at night.
You can sleep well at night. Well, before I let you go, very quickly, what are your plans for KPJ Healthcare in the next 10 years? What do you envision for your organization?
So the vision for KPJ Healthcare is to be the preferred healthcare provider. Currently, we have 26 hospitals. By year end, we're going to have another 2 hospitals in the group, so we get 28. Plus another, we have nursing college. We have, and for the mission, how to get there is to deliver quality healthcare services.
Right.
Why we want to be the preferred healthcare provider? In layman term, whenever you get sick, you think of KPJ. Whenever you want information, you think of KPJ. If you want to buy something online, you think of KPJ. We have the KPJ, KPJ Shopee.
On that note, on that note, we'd like to thank you, Tuan Haji, for joining us on the show and for telling us a little bit about your life and your vision for KPJ Healthcare Berhad. Thank you very much for taking time off your busy schedule. Do stay with us. We're going to take a short break, and when we come back, of course, we're going to bring you a little something with regards to ENT disorders or non-cancerous ENT disorders, all happening right here on Medical Today. Stay with us. Thank you for staying with us right here on Medical Today. We just talked about the whole medical industry within Malaysia. Very interesting conversation indeed. From there, we moved to a little interview we did at the facility itself. I was at KPJ Damansara Specialist Hospital, and I did get a chance to visit a Dr. Teck Siang. He's an ENT surgeon. Amazing man, this guy. He subspecializes in otology and neuro-otology, and he also put a couple of contraptions through my nose and ears. So it was quite an experience for me. And what we spoke about was something very important in ENT disorders or non-cancerous ENT disorders. He walked us through it and what it's all about. Here's that very interesting interview. Let's take a look at Dr. Teck Siang's interview at KPJ Damansara. Dr. Ng, thank you very much for taking time off to give me an interview in your office. There are a lot of people waiting out there, but no, I guess they'll have to wait for a little bit because we have so much to ask you with regards to what you do. Now, you're a ENT surgeon and you subspecialize in rhinology, so which simply means you're a rhinologist. In simple terms, for those of us who don't know about medicine, What does a rhinologist do?
Okay, rhinologist is a branch of ENT. We are more focusing on the nose and the sinuses, the nasal sinuses. This is our specialty. We call it subspecialty. We are more focused on that part. You know?
Right. But you know, if you go back a little bit, why did you want to take up ENT? You know, all of doctors, they do general medicine, and then they look for specialization. What made you fall in love with ENT?
Okay, ENT basically is a very challenging field because it involves a lot of like the cavities on the skull, right? The ear, the nose, the throat, right? So it's something a little bit challenging for me because when we study the subjects, we study the topics. We not like other disciplines like abdomen or heart or hand and legs. You know, there's like a very like a large structures for us to see. Whereby the ENT, the ear, nose, and throat is all very like small cavities. So for us to view it is a bit challenging,
right?
Especially when we try to learn about it, right? Follow the seniors, follow the lecturer to learn about it. They will be a bit challenging. I feel it's a challenging field and to practice. That's why I take up the ENT.
And of course now you're very successful at it, which brings me to some very simple things we talk about now. When we talk about ENT, someone asked me to ask you this question. Said, does an ENT specialist see singers? Because singers, you know, involves their throat. Sometimes they're worried that they're losing their voice or they can't hit the pitches they used to. Do people like that come and see you?
Yeah, of course. I see many all walks of life. I mean, from people from all walks of life. So we do singer, we do, you know, speakers, performance.
Right. So have people come and asked you, Doc, I want my voice to sound lower. Can you help me do that? Have people asked you for this kind of request?
So far, not really. But most of them that come, they will like their loss of voice. The voice become hoarse, or they have like the nasal voice, nasal speech is heavy. They want to figure out, you know, how to reduce the nasal
so you
speech.
can figure that out.
Yes, because when we speak, the voice is actually articulated by the vocal cord, but involve the diaphragm, involve the sinuses, involve the nose, involve the cavity, and the tongue. Involve a lot of structures when we speak. So not only the voice box, but actually they involve other structures.
Right.
In order to sing well or to speak well, I mean the sound suites, you know, the voice.
Right.
You must have a very good sinuses and a nose, right? And then you must have a very good like the oral cavities. Right. The way you speak, like involve the abdomen, the diaphragm. You know,
how much of air you're pushing up,
exactly,
so on and so forth.
Yeah.
Now, a very interesting thing that comes when you talk about ENT and of course your subspecialty, which is rhinology, is the fact that we always talk about sinuses. I have sinus, or I have sinus problems. Probably grammatically that's wrong to me, but most of us, I think, don't understand what we're dealing with. So when we talk about the sinuses, where are the sinuses located?
Okay, when the law, I mean, so far, we see a lot of patients coming here. They will tell us, a doctor telling me that I have sinus. So I always tell them, sinus is a structure. Sinus is defined as a cavities, a space with an opening, with a door. So it can be on the face, it can be in any other part of the body. But when it happens, when the sinuses is located on the face, we call it paranasal sinuses. It involves the cheek. Behind the cheek, there's a hollow space surrounding the nose, just near to the eye, the eyeball. Then there's called ethmoidal sinuses, and involve the eyebrow here. It's called fundus sinuses.
Right.
And deep inside, there's another sinus called sphenoid sinus.
Sphenoid sinus. Where's the sphenoid sinus located?
It's way back into the nose.
Way back. So can I safely say that around the nape or the back of the head?
No, in the center of the skull. exactly the center of the skull. Yeah, you couldn't see from outside.
Right.
We have to put a endoscope, or we have to do a radiological examination. Then we can really check it out whether it's any disease or not.
So it's very, very interesting that you say that there are sinuses all over your body, but the sinuses we're dealing with are called the one head upwards, the one on your head is called
Paranasal sinus.
Paranasal sinuses. Yeah. So okay. So when we say we have sinus problems, are we talking about rhinitis here, or various problems that come along with it?
Okay, the sinus is a structure, as I say. It's an anatomy, it's a structures. Rhinitis is a symptoms. Rhinitis means, it's a medical term. It means that your nose have a nasal discharge. Your nose is red. It's called rhinitis. Just like a flu, you have an allergy, you have some reaction to dust, fumes, or to food, or you cry. It's called rhinitis. It's not a disease. It's just a symptoms. And the sinus is a structure. Don't miss out. Don't make a mistake. So sinus is a structure. Sinusitis is a disease of the sinus.
Sinusitis is a disease of the sinus. So,
correct.
Which means if you have an infection in your sinuses, that could be known as sinusitis.
Correct.
So, okay, so rhinitis is a problem that the nose is always
mucus.
Mucus is flowing out of the nose.
Yep.
Sinusitis
is a disease of the sinus. So when we talk about sinusitis, that means it's a disease of the sinus. We don't talk about sinus, but for the people, that for like easy for them to remember the term. I think most of the doctors say, "Oh, you got a sinus."
Right.
But it doesn't mean you have sinusitis. You probably have some allergic rhinitis. Probably you have some flu, or probably you have non-allergic rhinitis.
Okay.
There's
so
many diagnoses.
Out of the 100% of patients that come and see you with these problems, can we safely say that about 60% have some sort of rhinatological issue?
I would say yes. I don't have a record, but I would say yes. Most of the patients, they come to see me, they have a sinus problem, they have a nose problem.
Right.
Right.
So that also, when you say nose problems, it also happens on the skin outside. So if you have rhinitis, correct me if I'm wrong here,
Yes.
so that means there's a release of histamine of some sort, right? And you get all the itch like pruritus and whatever. Is that sort of related?
Yeah, of course. Okay, when you talk about this histamine, right? You're talking about histamine. Histamine is like a chemicals in your bloodstream. When you have allergy, when allergy started, the process of allergy is that from A to Z, right? So part of it is the histamine, they're causing the allergy being like a flare out, no? The histamine will cause the blood vessel, the pores. Then the blood vessel is like a tube, and there's a tiny hole that it will be enlarged, and then the fluid from the blood vessel will comes out from the blood vessel, will cause the nasal congestion and the mucus in the nose.
Right.
So it's part of the process, the histamine. And we're talking about the eye and all this, the itchiness and all this.
You could start rubbing your eyes and blowing your nose. You know, you've seen that before, yeah.
When the allergy started, you have few symptoms. You have the itchiness, you have blockage, congestion, you have the rhinitis, the nose is having discharge, and the sneeze. Basically, this is the allergy symptoms.
Right.
Yeah.
Right.
This is just the symptoms.
So it's very interesting. So that's one problem. The other problem is ear infections. A lot of us have ear infections, or we start to have ear infections, but we don't care about it. You know, and like we have stomach problems. We go buy medicine for the stomach, but somehow when we have ear problems, we don't want to care about it. We just leave it be. And the worst thing we do is clean the ears. Is it bad? No, a lot of friends of mine tell me that you should stop using earbuds. Is that true?
Okay. When we're talking about a ear, the ear have its like process by itself. We call it self-cleaning. You don't have to do anything. The wax will come out by itself. It's proven. We have done, many researchers have done across the world. The wax will come up by itself. You don't have to do anything. It's called migration theory.
It's like called the migration theory.
Yeah.
See, I'm learning something new today.
Yes.
Right.
It will come from the membrane, the tympanic membrane, and then it comes out into the external ear, the ear from the environment. So the whole process is take about a month for the wax from inside to come out. Basically it moves about 1 millimeter per day.
Oh.
So it actually walks by itself.
Okay, so you just need to leave it alone and not disturb it.
Yeah.
I think the best thing we should do now is for you, I know inside that office of yours you've got all these machines.
Yeah.
If you can show me how these machines work and probably take a look up my nose, and maybe we can have a better idea of what we're talking about.
Absolutely,
Yeah,
that's a good idea.
Yeah, let's
do it.
Okay, so you're going to show me a video here, or, and what are you going to do with this?
So we're going to do, I'm going to pass a scope. This is a scope, this is a camera and the light.
Okay.
There's a front, there's a camera, and there's a light. It will show the way into your nose.
Yeah.
So we're going to...
I think this is a bad idea. Should I just go home now?
No, take it easy, don't worry.
Really?
Every day I do the same thing, don't worry. Not going to hurt you, not going to cause a pain.
Okay.
Just sit. I mean...
so this is not painful?
Yeah, it's not painful.
Yeah.
You feel something,
right.
something, you know, but they're not going to cause you a lot of pain, right?
I can do it on you also.
No, exactly, exactly,
okay.
no.
Okay.
No problem, no problem. If you can do it, I no problem, but
Okay.
this is not a good idea.
This is very
okay, look at the TV.
Okay, I'm looking at the TV.
Look at the TV.
Okay,
you see what I see, right?
Okay, yes. Okay.
So we're going to see. We're going to pass this camera.
Okay, so
we're going to pass the scope into
all,
the nose.
all of the country is going to look at my nose now.
Yeah,
okay,
that's good. That's
great.
good. And do you agree for that?
Yeah, I agree.
Yeah,
I
that's
agree.
good. Okay, come. Mr. Jared, you just sit forward a bit. Then let me adjust your headrest.
Okay.
Okay, your head look down a little bit. Okay, I'm going to hold your scalp.
Okay,
I'm
and
going
I'm
to pass
afraid.
the scope into your nose. Go. See, you see what I see, right?
Yeah.
Okay, look at the TV. This is your turbinate.
Okay.
On your right hand side is a turbinate. On the left is a septum, right?
Turbinate and septum.
Yeah, exactly.
Okay.
This is turbinate. Okay, and this is on the left nose.
Okay.
You're gonna see the right nose. Okay. Now on the left is a turbinate. On the right is a septum.
Right.
Right. Okay. Looks pretty good. Okay. I'm gonna like pass the scope into your nose all the way back from your nose to the throat, the junction of the nose and the throat. Okay, don't move. Okay, okay, don't move. Okay, you feel a little bit this one pressure, but you're not going to cause you a lot of pain. Don't worry. See, I go very slow. Okay, good. Don't feel anything, right? Okay, this is your throat. This is the eustachian tube. You see the left hand side at 9 o'clock.
Yeah.
There's an opening. It's called eustachian tube, and at the back of it is the fossa rosum. Okay, and the back here, the center one is a nasopharynx. It seems like a lot of phlegm in the pharynx, right? I don't see anything significant or abnormalities. Okay, it looks good. Okay, done.
So
you see any pain?
There was no pain. That was fantastic.
Yeah, exactly. I don't need to put any medicines. I don't need to do anything. I just pass the scope into your nose, and we see what we should see.
Right. So you don't have to anesthetize me or give me any spray to do this. Nothing.
Not for you. For certain patients, I do that, but not for all the patients, because I want to see the nose as natural as possible.
Okay.
I don't want to change it, you know. But however, I don't want to miss it as well. So I need to go in very detail. I need to go very slow, and we need to go in all angle, all area to make sure I don't miss out anything. Okay, I need to go up a little bit for the same nose. Okay, that's how we go all from front to the back straight.
Oh, it hasn't completed?
Yeah.
Oh my goodness.
Okay? I need to go up a bit.
God help me.
Yeah. We are like.
I do quite a dangerous job, so now I hope half of Malaysia knows this. I'm doing this for national service.
No problem.
Oh my goodness. Here we go
look,
again.
Look at this. This is your.
I'm trying to.
This is your sinus, your medial turbinate. Your medial turbinate is inflamed. Okay, I don't see any mass. I don't see any polyps. Your nose look great. A bit of mucus. Okay. your anterior skull is all normal, no mass. See that? Yeah, I'm done. Okay, I'm done.
Oh God, you made me cry. You just made me cry.
I see your sinus opening. I see your medial turbinate. I can see the scalp, the anterior skull base.
Right.
I don't see any mass. It's good. Okay. I need to go the other side. I need to go on the right hand side, left hand side.
Now you're going the right hand side.
Yeah, we done the right,
Right.
and then we go the left. Okay. Same thing I'm going to do.
Okay.
I'm going to pass the scoop into your nose. Sit quietly. Don't move.
Right.
Okay. Everything will be good.
Okay.
Right.
I've got about 1 million questions left to ask you, so we need to do this really quickly.
Right. Let me do it. All right. Don't move, okay? This seems to be more congested than the other side.
So we're looking at a deviated nasal septum.
Yeah, a little bit, not significant. Okay, this is your nasopharynx, and on your right hand side is the eustachian tube. It's connected to your middle ear, and rosal is all clear. Okay, there's a little bit mucus in the nasopharynx, in the oropharynx. Okay, no, look at this. Look at this.
Yeah.
Mr. Jared, look at this.
Okay, what am I looking at?
This is very clear. This is your opening of the maxillary sinus. I mean the medial mucus, medial turbinate.
Right.
We go up, and we can see the anterior skull base.
Okay.
All clear.
Okay, Malaysia, you can
all
see my
clear.
skull base now.
Yeah, anterior skull base. This, and on the top of it is the bone that separate the brain and the nose. It's
Right.
all clear. No mess.
So when someone is having vertigo, what's happening here?
Vertigo is dizziness.
Dizziness, okay.
Is-
Is something blocked or is the balance not right?
Okay, vertigo is a huge topic, but if vertigo is caused by the ear, the symptom will be like quite severe. You have like probably like vomit, like nauseated, and you have like spinning. You cannot even like stand out or walk. You know, if there's the inner ear, there's a problem. The balancing apparatus, there's some disease. The symptom will be severe. You don't even like you have to lie down on the bed. You cannot even like sit up or walk. You know, or you will be like vomit, nauseated. You know.
Right.
This is a vertigo caused by the inner ear. But if the cause is by other system, like for example the eye, the muscle, the joints, it will be lesser. The symptom will be minor. I mean, not so serious, right? And it can cause by the brain as well. Let's say you have a stroke, you have a growth in the brain, or like the growth is like pressing on a nerve. That the symptom is.
So it can be caused by many
Exactly.
problems or various symptoms. So when you feel that your balance is out, I think the best thing to do is go and see an ENT.
Exactly.
Go check it up straight away.
Exactly.
Right.
Yeah. I'm going to take a look of the ear.
Okay.
The ear will affect the balance.
I thought this was going to end, but it continues.
Yeah.
Right. Okay.
With this scope, we can go like the ear, the nose, and the throat.
Even Inche Hassan, our cameraman, is laughing at me now. So
All right, great. Okay, let me take a look.
Yeah. Okay. Let's
look at TV.
Okay, Malaysia. Let's look
very
at my
clear,
ear.
huh?
Okay.
Look at this. This is your external ear.
Okay.
There's a little bit of hair over here, but you look at
Not on my
inside,
head,
all
though.
clear, no hair, right?
Yeah.
It's outside. There's a skin. Skin is invaded about 1 cm into the ear,
Okay.
and thereafter there's all mucosa. There's no skin, no hair, all clear. Your membrane is at the end of this scope.
Okay.
The white, like a pearl color, transparent kind of thing, the round one.
Right.
That is the tympanic membrane.
Okay.
Right. I'm
So-
gonna freeze it. Let me freeze it for you, the image.
Okay.
Okay, you see that? Sorry.
There, Malaysia. That's my membrane.
Look at the membrane.
Okay.
And it's good. It's very
good?
It's healthy. Yeah, it's young as like 40 years old.
For 40 years old.
Yeah, it looks very good.
Oh,
But
wow, beautiful.
You don't take your ear, okay? You had a habit of taking your ear. Look at this. This like a sign of like kind of an injury, you know,
Injury,
but not
okay.
serious. It's
So
very
I have-
minor.
You know now that I dig my ears.
Wow.
Damn it.
Okay, let me take a look of this, the right ear, right? Same thing. A little bit of wax outside is okay. It's like kind of like protective. And then you go in a bit. There's no hair, no skin, or mucosa. The membrane is good, very healthy. See, very good, all transparent. And you see a cone of light. And you see the shape. You see the color. Everything is good. Yeah, the membrane is good.
Fantastic.
Right, great.
So now, couple of things we need to talk about. So maybe if you can come this way and I can take a look at that. Now, when we have sleep apnea, what is happening? So sleep apnea has got nothing to do with this. It's largely to do with what happens in your throat. What is happening when people have sleep apnea?
Okay. We're talking about sleep apnea. Apnea means you stop breathing. Sleep means you are sleeping. When you sleep, you stop breathing. So what is the cause?
It doesn't sound good, huh?
It doesn't sound good, yeah. It could be like obstruction. It could be like the nerve problem. It could be both. But when we talk about ENT, sleep apnea, we mainly focus on the obstruction.
Right.
The main obstruction, it will be on the nose, and then followed by the throat. So when this nose is obstructed, the patient will open the mouth to breathe. When the patient open the mouth to breathe, it will cause the dryness of the throat, and subsequently probably have like sore or discomfort in the throat. This problem is like going on and on. Even
So,
though
what can be done?
you can try like some treatment to see whether it's like relieve the apnea or not.
Right.
Or you just correct the.
Some people have like a sleeping apparatus where they put over their mouth at night. Do you prescribe stuff like that?
It depends on the situations. Most of the time, I don't. All right, I don't do that because I must see whether there's any like the disease or the problem in the nose or in the throat, and they will try to correct it. Right. Instead of like using the apparatus, and the apparatus is like more for a certain group of patients, but not for everyone.
Not for everyone.
Yeah, this is my practice.
But so there's many ways. You always look at different options, and you always look at the simplest option.
Exactly.
But I guess before we end this interview, what would be your message to the country or to Malaysia with regards to ENT health?
Okay, ENT is, as I say from the beginning, it's a very challenging like a field, specialties. If you have any ear problem, nose problem, or throat problem, please come to see ENT. Don't try to settle it by yourself because it's stuck with a small problem. If you do it well or you don't treat it correctly, it can be the problem will be like more problem, more major.
It'll be more pronounced here. These problems.
Exactly. Yeah. So don't wait until it become more pronounced or more serious. Then only look for ENT.
Right.
Is there any like curiosity or any doubts or any problems? Please go and see the doctors, and if possible, refer to ENT.
Right.
Yeah.
So, if possible, what you need to do is refer to an ENT. So, something as simple as a blocked nose or a blocked ear, please go see an ENT as soon as possible. On that note, we'd like to thank you, Dr. Ng. It was a pleasure coming to your clinic and getting the rest of my country to see the inside of my cavities up above. Well, what can be said is if you do have any problems with regards to ENT, the ENT area of your body, please make sure you go to a proper trained ENT. If you're going to do alternative medicine, be careful, check with an ENT, a specialist like this first. I'm Jared Ratnam reporting from KPJ Damansara for Medical Today. Thank you very much, Dr. Ng.
Thank you. Have a good day, everybody.
That was Dr. Ng Teck Siang, ENT surgeon, subspecializing in otology and neuro-otology from the KPJ Damansara Specialist Hospital. I had a chance to visit them, and it was a fantastic day just visiting doctors and looking at what they do at the KPJ Damansara Specialist Hospital. On that note, we'll take a short break, and when we come back, we have a video for you right here on Medical Today. Stay with us. We're back. This is Medical Today. Jared Ratnam with you. And in our final segment on season 3.0, it's a little something we do on a weekly basis. And today we have something called the first aid mistake video. It's back, and we're looking at disinfecting wounds with an antiseptic solution. Now, stop for a while and think about it. How do you disinfect wounds? Have you done it before? And if you have, are you doing it right? Now, if you're not quite sure, take a look at this video. It will definitely give you some information as to how you can disinfect a wound with antiseptic solution. Let's take a look at this video.
The mistake is disinfecting wounds with an antiseptic solution. A lot of us have learned to clean our cuts and scrapes with rubbing alcohol, hydrogen peroxide, or iodine. But those antiseptic solutions can hurt your healing time. We all know the bubbles we see with hydrogen peroxide, but contrary to popular belief, those are your body's skin cells that help promote healing, and the sting from alcohol is your healthy tissue being harmed. Well, do this instead. To get debris and bacteria out, it's best to hold the wound under the tap and wash thoroughly. If it continues to bleed, apply direct pressure until it stops. According to Best Medicine by Renowned Health, once the cut is clean, you can apply an ointment like Neosporin on it for protection. Ideally, let the cut air out or cover with a loose bandage.
Well, I hope you gleaned some information out of that very interesting video. So it's called Disinfecting Wounds with an Antiseptic Solution. Now, the go-to standard is to get the debris and bacteria out. The best way to do that is to hold the wound under running water and to run it through a tap. But once again, there's many things that needs to be done. So if you can't handle the situation, make sure you dial 999 and get information out of them as to how you can deal with the situation at hand or on hand. On that note, this brings this week's edition of Medical Today to a close. If you do have any questions for us, please send me or send our team an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll get the doctors you'd like, or if you'd like for someone to be on the show, we will try our very best to request for them and to bring them on Medical Day. On that note, don't forget, next week we have Professor Dr. Imelda Balchin Tan Sri Nasaruddin from KPJ Damansara Specialist Hospital coming in to talk about obstetrics and gynecological disorders, all happening right here on next week's edition of Medical Today. You have a fantastic day ahead and a great week. Bye-bye.
You